the relevance of GCase to Parkinson's disease is something that has emerged already several years ago when researchers found that patients with Gaucher's disease could also show Parkinsonism. And then they started investigating the genetics behind this, and they found that mutations in the same gene that causes Gaucher disease can be a risk factor for Parkinson's disease. And based on what was known for Gaucher disease, the hypothesis was that the mutations would be reducing the activity of this enzyme, glucocerebrosidase, and that this could lead to an accumulation, a buildup in the substrate that is normally degraded by this enzyme, and that could be accumulating, thereby causing problems. Now, over the years, we've evolved a lot in our understanding of this pathway, of how this enzyme works, which substrates it uses. It converts glucosylceramide into ceramide and glucose, and it does other things as well. And there have been even clinical trials. There was one clinical trial using a molecule that would basically try to limit the accumulation of the substrate that would then not be processed by glucocerebrosidase. Now, unfortunately, this strategy failed. So the clinical trial was negative, it was interrupted, and this didn't go forward. But now there's still hope that maybe by modulating the activity of this enzyme, we might be able to have some benefit in Parkinson's disease. And some of the strategies are being tested now. They would aim at increasing the activity of this enzyme, which we now understand may be beneficial because it will probably also help the cells process the protein that is mostly associated with Parkinson's disease, which is α-synuclein. And so by increasing the activity of glucocerebrosidase, it's a tough name, the levels of α-synuclein might be normalized as well, because maybe the autophagy lysosomal pathway would work better and α-synuclein aggregates might be degraded, and so they would not accumulate, avoiding the problems associated. So this was the controversy. Should we increase or decrease the activity of this enzyme? And I was defending that we should increase because that's based on a lot of the current understanding of the pathway. But there is also a strategy that suggests that maybe we need to decrease this activity because of our understanding of other aspects of the pathway. And so it seems that we cannot really say that in the patients, what we have is a drastic reduction in the activity, or at least in the levels of the enzyme. So it's still a bit controversial. But I think the strategy, at least based on the evidence we have today, the strategy that seems to fit best is that maybe we should increase the activity, thereby trying to improve the handling of α-synuclein in the cells. And so that was the position I was defending in this debate.